Dr. Elizabeth Hawkins is a clinical psychologist, behavioral health consultant, and a food allergy mom and advocate. She holds a PhD in child clinical psychology and an MPH in health services from the University of Washington. Dr. Hawkins is licensed and maintains a private therapy practice in the states of Washington and Oregon. One area of specialization is working with food allergy families to manage the accompanying stress, anxiety, and traumatic experiences that tend to go hand in hand with allergies. She's also a mother of 2 children. Her youngest daughter was severely allergic to more than 20 foods, including 7 of the top 9 allergens, and suffered from severe eczema and environmental allergies. Some of her allergies were outgrown, some have been successfully treated and now included in her daily diet, and she's currently undergoing treatment for others. In her book and in her practice, Dr. Hawkins combines her personal experience and education and training to help build and maintain emotional health and well-being for those living with food allergies. For most of us, it is us really, our family life of living daily with life-threatening food allergies. So welcome to Immunity Group podcast and webinar, Dr. Hawkins.
Thank you for having me. I'm happy to be here. And thank you for organizing this. This is really a great experience for me.
I have been immersed in your work over the last 48 hours again, rereading some of amazing sort of insights in chapter 12 of your book, which you have kindly provided for all of us food allergy families globally. And interestingly, Dr. Gabor Mate, who is a well-known international Canadian-Hungarian physician and a specialist in child development, he actually says that early childhood stresses during the first years of life are crucial for brain and personality development, and that this has huge impact on self-esteem of children. Now, I wanted to ask you from your professional and personal insights, how does early childhood development and living a food allergy life impact our children generally, and how can that have an impact later on in life?
I think it has a huge impact. Obviously, those early years of a child's life and the attachment relationships they have are critically important. And in the context of food allergies, I think during those early years, especially, our kids are learning a lot from how we act around them in terms of their allergies. So they're learning things about, how do I make sense of this thing that's a part of me? And for those who have had allergies since they were very young, they might never have known any other kind of life. So that's all they know. But it's a part of them as much as any other part is. So they're trying to make sense of that and think about how to think about it. And they're also learning how to think about the world around them, their own sense of capability, their own sense of lovability and worth. And so I agree with a lot of what Gabor Mate has to say. And I love his book, Hold On to Your Children. That's one of my favorite parenting books, especially for the adolescent years. And I think there's a lot of wisdom in thinking about, we teach our kids so much through our words, but we teach them even more through how we act around them and our nonverbal cues. So our facial expression, our tone of voice, our body language, we're conveying a lot of information to them during those years that they pick up on and they internalize.
As food allergy families facing life with life-threatening food allergies on a daily basis, I guess a lot of us were introducing foods with a lot of fear once we knew that the children are reactive or officially diagnosed. When it comes to those nonverbal cues, and I would like to explore that idea further, what would you advise newly diagnosed parents who are very new to this field in terms of that, managing that fear and anxiety of introducing foods at the same time as managing food allergies in their own emotions?
Are you talking about introducing the foods that they're allergic to in the context of treatment, or are you talking about just introducing new foods to young children?
Introducing new foods to young children once you have had a diagnosis for a certain number of allergens, but there is still this residue fear.
Yeah, it can be terrifying as a parent, right? This thought that the food we give to our child could cause a life-threatening reaction. It makes sense why there would be so much anxiety and fear and hesitation around that. And I want to be careful in everything we're talking about, because when we're talking about it intellectually, it's really easy for me as a psychologist to give advice and tips that sound very neat and tidy. And the reality is it's hard to do that in practice. And it's hard to do that in the moment. And so we're talking about kind of best case scenarios here. I just want to acknowledge that. In terms of how do we do it as parents, I think we have to be very aware that our kids are reading our faces. And so if we're looking anxious, if we're gritting our teeth, if we have, like tense shoulders, they're going to pick up. Even very, very young babies can pick up on that emotionally and sense that something is wrong. We're upset about something. And so they're going to learn to be upset about it. They're going to learn to be fearful. So as much as possible, I think food allergy parenting starts with parents learning how to regulate their own emotions, which is really hard to do. But learning how to recognize what you're feeling, validate what you're feeling, have compassion for yourself, and find strategies away from your children to be able to regulate your emotion and have social support so that in that moment you can show up for them and convey to them a message of, yeah, this, we don't actually know how this is going to go. When you're introducing a new food, there's an unknown component, and our brains don't like unknowns. The unknown is scary. So I think being able to hold space for ourselves and for them of, we're going to try this and we're going to see, but we know that we can handle whatever happens. So we're giving some competency and some confidence in how we act. And again, a lot of that is not words. Sometimes we rely too much on words, and it's really more for young children in our facial expression.
I loved your concept of psychological flexibility. I have to say, I have never explored that concept before. And what came to mind is the opposite concept of psychological rigidity. Can you please explain to our audiences what is psychological flexibility when it comes to managing food allergies?
Sure, I can. And just to be clear, I did not come up with the term psychological flexibility. It actually comes from acceptance and commitment therapy, which is a form of cognitive behavioral therapy, or CBT, which is kind of the gold standard for dealing with anxiety and related conditions. And so acceptance and commitment therapy, the way it is a little bit different from some other kinds of therapy is that the core of it is around making space and being open to uncomfortable emotions and thoughts and the distress and the pain that goes along with those. So the idea is, rather than engaging in these battles to try to control them or eliminate them or get rid of them, that we can instead choose to live alongside our uncomfortable thoughts and feelings, and then make conscious choices about doing things that are important to us and lead to a full and meaningful life. So in the context of that, the core of how to do that is this concept of psychological flexibility. And it really gets at the ability for a person to be able to hold lightly to your thoughts and your emotions. So you recognize them, they're there. You can maybe even have the awareness of like, what are they trying to tell you? What are they there for? But you don't see them as absolute directives on what to do. And so in the context of food allergies and food allergy anxiety, a lot of times we feel like if we don't feel good about something, if something feels uncomfortable, then it must mean we're doing something wrong. And the idea of psychological flexibility would say we can actually hold tightly to, this is uncomfortable, maybe this is new, maybe this is really frightening for us because something could happen. Our child could have an allergic reaction. And we're choosing to balance that on the other hand with our values, the things that are important and give life kind of the richness and the color and the meaning, and our goals. And, we're kind of teeter-tottering between those. And we're trying to stay in the present moment, not fast forwarding ahead to what might happen. And we're learning how to tolerate those difficult experiences and just live with them.
Can we become more personal now and talk about your journey of exploring your own emotions when your child was diagnosed? If you can please tell us about that time and what kind of impact did that have on your life? Was that a catalyst for you to study child psychology, or did you already specialize in that? So just at sort of personal beginnings after diagnosis.
Sure. I already was a psychologist, so I had already gotten my PhD in child psychology. And when my second daughter was born, so I already was a licensed psychologist. We don't call it registered here, we call it licensed psychologist. And my specialty was always child adolescent psychology. I love parenting. I love working with people with anxiety disorders. So in some ways, it was perfect for what came next in my life, which was having a child with food allergies, and so many food allergies, kind of right from the beginning. And so For me personally, it was a very scary time because I think for many months we didn't know what was going on, and I was getting poor medical advice from our pediatrician in terms of the seriousness of what we were dealing with. But once my daughter was, probably about 9 months old, we started getting into an allergist and getting the testing and starting to clarify what was going on. And I think at that point in time for me, I saw, wow, I can totally see why someone would develop phobias and anxiety and obsessive compulsive disorder. Like, it's very clear how easy it would be to develop clinical anxiety around something like this, because my instinct was to bubble wrap my daughter and never let her go anywhere, right? As a mom, that was, okay, I have this child who's allergic to, 20 something foods. It seemed like almost anything could kill her. And she was having reactions, she was having contact reactions. She has other just environmental allergies. She's allergic to the cold if her body temperature drops. She's allergic to the sun. She gets hives, from if the sun is intense. So there's all these things that just made it feel very fragile. And so my urge was never let her go anywhere, just kind of attach her to me, which worked really well when she was little. But, I also had a presence of mind to realize, okay, this child has to grow up. She needs to be independent one day. So I was, even at a very young age, I was already thinking about, okay, she's going to have to go off to college. She's going to have to live on her own. I'm hoping if she wants to, she's going to have a family one day. I was thinking very far ahead into the future for her and thinking, I right now am teaching her how to think about this part of her. And at that point in time, we didn't have a lot of confidence that she would ever outgrow or be able to treat a lot of the allergies. And this was 2008, 2009. So it was a long time ago in terms of the treatment field. And so my thought was, how do I help her accept this and love this part of herself the same as she loves any other part of herself, keep herself safe, and be able to not be scared of the world. And that made me realize I had to not be scared of the world. I had to be able to model that for her so she would know how to do that. So it really had a huge impact on me as a parent, and it made me much more intentional about what I was doing and the things like we were talking about earlier, like my facial expressions. I knew those things from my training, but it became real in a whole new way for me of dealing with something like this, where I thought, okay, so I really want to project how I want her to feel 5, 10, 15 years into the future about allergies, and to work through it from that perspective rather than letting myself be reactive to my anxiety.
What I found fascinating in your book chapter is, so even though you are so highly educated, a PhD holder, you said you started to actually really educate yourself about food allergies, like you really dug deeply into this field. Why is that?
Well, I knew nothing about food allergies. To be, before she was born, I knew just enough. I had an older daughter, and so the recommendation at that time was to introduce foods one at a time and do it very carefully and hold off on some of the more highly allergenic foods. I had done that with my older daughter, and she had a couple of, hives here or there. There were a couple of things that she had actually been tested for allergies and she didn't have allergies, but I didn't know a lot about them at that point in time. And so when this happened, I think I'm a researcher by nature. So the result of like that academic career, my way of dealing with my anxiety is to try to learn everything I can. And so I did take a very deep dive into learning about food allergies, learning about food more generally, learning about what can I use as substitutions for wheat, for egg, for dairy, for soy. I mean, she was allergic to 7 of the top 9. So the only 2 that she wasn't allergic to were fish and shellfish, which, a 9-month-old isn't going to eat a ton of that anyways. So I was learning how to do gluten-free vegan baking, because I wanted her to have just as beautiful of a cake or cupcakes for her first birthday as any other child would have. So, I think for me, it was a coping strategy for my anxiety to just focus on what can I control, and what can I learn, and how can I then use that to give her the experience I wanted her to have as a child.
Can we also include your environment at the time, your partner, your family? Did you find any challenges in managing them and their thoughts and opinions about your management of your own child's food allergy life? How did that play out?
Yeah. Actually, it's funny you bring that up because it wasn't maybe so much from my friends or my family. I think they were quite supportive, although shocked because I think none of them had experienced serious food allergies. So again, this idea that she could die if she ate the wrong thing, I think was just a foreign concept to most of the people in my life. But I realized I've always been a people pleaser. I've always been somebody who's very accommodating. And I realized for me to be able to keep her safe, I had to grow a thicker skin and be less of a people pleaser, be less accommodating, and honestly care less about what other people thought. And just realize, there was going to be a lot of people who judged me as kind of a crazy allergy mom, oh, she's just being anxious, but they're not going to understand it. And so for me, it was, again, it was less the people immediately in my environment, but as we started getting into school and beyond that, realizing, okay, I have to let go of what people are thinking about me and just know that I am doing the right thing. I know what's going on and I know what I have to do for her. And realizing that I wouldn't have known 5 years before all this, I wouldn't have known anything about allergies and what was involved in it. So trying to give that grace and make that generous assumption for other people that they don't understand, they haven't lived through it, they're not going to understand all the different kinds of precautions that we have to take, especially with a very young child who, is potentially putting things in their mouth all the time and is not the easiest to reason with. There's different skills and strategies at different ages for food allergy parenting. So I had to do some work for myself to become more okay with people judging me however they wanted to. And that's not my business.
So food allergy parenting has actually transformed your social relations.
It's transformed me for sure. Like I am a totally different person because of her food allergies and having that experience with her. She's soon to be 16. So we've been doing this for a long time. And I'm definitely a different parent. I think it brought me face to face with realities that a lot of us, I think, live in denial of, which is, we talk about food allergies being a life-threatening condition, but life is a life-threatening condition. Like, we'd like to have the illusion of safety, but we don't know what's going to happen. And so I think for me, I also had to become more comfortable with some of that, just existentially. And yeah, that had a big impact on me for sure.
And when it comes to siblings dynamics, how did you manage that? Because you had an older child who did not have life-threatening food allergies by the sound of it,
Right.
compared to a child with more than 20. How did you manage that?
Yeah, I think I just one step at a time and one day at a time. I can't tell you that I had an organized plan. I thought, okay, I have food allergies and this is how you handle it. Certainly was not pretty like that whatsoever. I made a lot of mistakes. I still make a lot of mistakes. And I think I just tried to be thoughtful. Like I tried to catch myself. I think more than anything, I would try to catch if I was feeling reactive and knowing what that feels like in my body. In terms of emotional reactivity. Like it feels different when you're operating from fear than if you're operating from a place of groundedness. So I think I would try to recognize and catch when I was being reactive and then kind of go back to my values. Like, okay, what's really important? What do I want to be teaching my older daughter? So my younger daughter was too young to rationally understand what was going on, but my at that point 4-year-old understood, and she understood that the foods that she loved the most, her grilled cheese sandwiches and her yogurt, were very dangerous to her sister. So we had to make decisions about what foods to keep in the house and in the family and which ones to maybe not have a part of. But again, it was slowly going through all that. It was talking to her, my older daughter, as in a developmentally appropriate way about what was going on. And I'm lucky because she's so sweet and she's a very kind and loving person. And she loved her little sister and she was worried about her. So she was pretty happy, to be able to make those accommodations. I think it might have been different if I said, you can never have dairy again, or tofu, or, some of the foods we loved as a family and we ate all the time. It could have been different if we had made choices as a family to get rid of all of her allergens out of our household. But instead we tried to always just do separate but equal. That my younger daughter couldn't necessarily eat the same thing, but I would try to get the same value for whatever she was eating. So if we would, we continue to go out to restaurants, we would go to parties, we would do things. I would try to give her a scaled down version of whatever we were having, the rest of us, so she felt more included. So again, I don't have necessarily like these really brilliant strategies. I think I just felt my way through those years, and those years were overwhelming and kind of blinding for me when I look back. It was a painful time. I was dealing with this, but I was also dealing with a mother who was dying of early onset dementia. And so these things were happening in parallel. Like I was bouncing literally between allergist and neurologist appointments and dealing with that. And realizing it taught me a lot about what I can control and what I cannot control. And again, making me just think about my values and try to instill those in my children.
Exclusion and bullying is often a facet of food allergy life. What are some of the strategies which you could potentially recommend to our food allergy families in dealing with institutions, such as schools or after-school care providers or any type of institution where a child is being looked after, to sort of prevent exclusion and bullying?
I think first of all, we have to define what exclusion is. I know there's a lot of differences in the food allergy community around what that means, and whether you exclude certain foods from classrooms or cafeterias or even whole schools. So that's a thorny topic that I don't know that we have the time to get into today. But if we're talking about excluding in terms of interpersonally, one-on-one, being told like you can't play this game with us because you have food allergies, or being made fun of, I think the reality is, that's an adult issue. First of all, that for parents, if they hear about some of that, going to talk to that institution, whatever it is, talk to the teachers, talk to the school, and try to figure out what is happening. And maybe there's an educational piece to that in terms of helping the other kids understand what's going on, or to be more kind. But I believe very strongly in, we can create cultures around children, and we can have cultures of kindness and inclusivity, or we can have cultures of exclusivity and meanness. And so I think thinking about it on that level, going to it's beyond just those individual children involved. It's also all the other adults around them and what they're modeling. On an individual level, there's things you can do with your child to harden them, or to kind of build their armor, so that the idea of whatever the other kids are saying isn't as hurtful to them. To some extent, we can't prevent them from having the pain of being excluded or being made fun of. But I think we can do a lot of work of making our kids feel good about themselves and that part of themselves. So someone else can make fun of them, but it doesn't hurt as much because it's not a sore point. But if you have kids that already feel like this is an awful part of me, I hate it, I would do anything to not have this, they are, make my life miserable, it's the worst thing that ever happened. If they already have that attitude, then the first time, someone else starts making fun of them, that's just going to pile more and more onto that in terms of their own sense of their self and their worth. And so I think, from the very beginning, we can take a different approach with kids, whether or not we want to treat allergies, regardless of what we want to do with them, as long as they're part of your child. And so teaching them to have as neutral to positive of a view of them as possible, I think, is a hedge against bullying.
And how did you start looking for a different approach, treatment? Tell us about that time.
Oh, well, I was lucky. So the first allergist that, I called, who was a mile and a half down the road from me, was an allergist that was doing private practice OIT. And in 2009, that was very unheard of. I think there was just a handful in the United States, maybe 4 or 5 doctors who were doing it outside of clinical trials. This is before the clinical trials had been completed. And he was doing it. And when he first said it to me, it sounded really scary and sketchy. And I was a little like, wait, what? And then I went and I started reading all the papers, and I realized, in my psychology brain, I realized, oh, you know what, this is interesting, because this is there's a parallel between food desensitization and what we do in mental health for anxiety is we do desensitization. We call it desensitization. exposure and response prevention, which in a way I started seeing all these parallels between treatments of like, okay, so I'm bought into the idea from a psychological point of view that we can retrain our emotional immune system. So of course we can retrain our physical immune system. So it started making a lot more sense to me. But that allergist, he started at 4 was what he generally would do. So he, right from the beginning, was saying, your daughter is a great candidate for multi-food OIT, which also was very unheard of at that point in time. There weren't a lot of kids that had multiple food allergies like she had. It's much more common now, but most of the stuff that had been done was only with peanuts at that time. And peanuts were a concern, but honestly, they weren't our major concern. If you had asked me what 3 foods would I like to, make her not allergic to, I don't even think peanut would be on my list, because I felt like peanut was there was so much awareness around it. Everyone knew to look out for peanut. No one was looking out for dairy. No one was looking out for sesame or lentils or, some of these other things that were a little more obscure. So we had this idea of maybe starting OIT at about age 4, when she could reliably talk about what was happening and what she was feeling in her body. And we got there and my mom died. And, that period was just the last, horrible months of her life. And then what happened afterwards. And I wasn't honestly ready to do it. I knew that treatment would be a big time commitment, a big emotional commitment. And so we put it off. And we put it off. And finally, when we were ready, my daughter was old enough and she did not want to do it. She had an opinion. And I realized I could try to kind of strong arm her into it, or I could respect her feelings and slow play it. So it wasn't that I was saying we would never do treatment, but I thought there's no reason for me to push an agenda right this moment. And then we moved and we switched allergists, and our new allergist did slit sublingual immunotherapy. And that just seemed like a gentler way. And she was very willing to do that. So it seemed like that was a way to maybe ease her into the idea of desensitization treatments and to get her some easy wins. Our hope was, she would have positive experiences and it would not be as scary to then consider doing OIT. And we could either use slit as a bridge to OIT, or his hope was that she had some kind of weird allergens like mustard and celery. There were like these ones that were probably not life-threatening, but they strangely actually got in the way of a lot of things, like celery, which you wouldn't think about, but it's in every soup. There's a lot of things that have a celery base or a mustard seed in it. And so he thought we could just get her to free eating with slit. And that's exactly actually what happened with slit for that. And then we used it as a bridge to OIT for some of the other foods.
What I find interesting is the concept of child consenting. Do you think there is sort of an age limit when they start becoming more opinionated about that? Because sometimes even 3-year-olds and 4-year-olds can be quite defiant in terms of, generally food allergy children have sometimes aversion to new foods or to new textures, to chewing, but potentially more so than the general population.
Right.
Just in terms of that sort of age and consent, if we could explore that a little bit further, please.
You're right. And, the reality is we often try to override our children's consent on all sorts of things as parents, and that's part of our job. The way I think about it, I try to step back and look at it kind of big picture. And I think about it as your relationship with your child, you have an emotional bank account. And, there's all sorts of connection. There's all sorts of things that are putting deposits in that bank account. And then there are things we do every day that are withdrawals. And, that is correcting our child, telling them a different way to do something, or trying to overpower their will. If we're going to be honest, there's a lot of things we kind of force our kids to do that they don't want to do. And every one of those things is a withdrawal from the emotional bank account. So one of the ways I think about consent is you have to have a big enough emotional bank account to be able to handle that withdrawal, because trying to force a child who is naturally averse to a certain food, who maybe has a bad experience so they can remember that they don't like the taste, like you're saying, they don't like the texture, to try to get them to every single day eat that food for who knows how long, we don't know what those outcomes are going to be for any individual person. That's a big ask. And so I think thinking about that way of like, okay, so if I, in an ideal world, we want our kids to say, yes, that sounds great. And I see the reasons why this is good for me. And I understand how this will benefit me as a teenager and an adult. And they never do that. You know, my daughter, when she was probably about 8, she was like, I'm fine with my allergies. My allergies don't bother me whatsoever. Like, she felt very positive about them. She felt like they made her special. And her life was working great because I was managing every single component of it. And, you know, I knew we're just a few short years away from her wanting to, you know, go out with friends, not take her mom along, wanting to have, you know, probably sleepovers with friends, wanting to date, to kiss. Like, I had in my mind all these things that she was going to want to do that she was not aware of yet. So I think it's tricky. So, you know, to your question of consent, I don't think you can overpower kids. I think it's a mistake to overpower them. And so what we have to do is we have to use our influence and our persuasion to try to get kids to cooperate. And the currency for cooperation is connection. The more connected they feel to us, the easier that's going to be. And I get that that doesn't work with all kids. And some kids have sensory issues, or they have neurodivergence issues. Like, there's other things that make it sometimes much harder to do. But kind of as a general rule, I would say lean in to building up your emotional bank account with connection points, so that you can then try to influence them into doing that if you've decided as a family that that's what's in their best interest.
So there is a lot of strategy involved in sort of managing the OIT journey. What I find in the literature as well, there is a lot of talk about avoidance and anxiety, or even after graduation, managing a new life, but there is not enough discussion about this period of transformation and managing, like you said, your own emotions. From the providers whom you saw, was there an element of psychological support, or did you have to create everything by yourself?
There's very little. So our first allergist did give me one good piece of information. He said, I almost quote, like, don't be a crazy food allergy mom. Like, and that's very derogatory, you know, but he said, I see too many parents, usually moms, who fall into the trap of trying to control the entire world around them and trying to control everyone else. And he said, it's always a losing battle. And she was, you know, this was like, she's probably 11 months old. You know, I was still carrying her around everywhere. He said, don't try to control the world. Try to teach her. Focus your energy on building her up and her understanding what she can do and what she can't do and her boundaries. And I chose to take the good part of that message and let go of his crazy food allergy mom part of that, and really zero in on what I feel to be really true. And that is, I can't control everybody else. I can't control every child at a playground and what they've eaten. And I will drive myself crazy if I am thinking, did they just eat a peanut butter jelly sandwich? What is, you know, if I am trying to manage the entire world around her, I know I can't handle that. I just know I will go back to that. I'm going to put her in bubble wrap and put her in the closet, and she's never going to be allowed to leave our house, you know, where I can't take care of her. So I really invested in her. And I think that is, you know, ultimately was a very valuable piece of information. Other than that, there was nothing. There was no emotional support. And quite honestly, there was not any real support. He taught us, I don't even know if he taught us how to use an EpiPen. He did explain what food allergies were and why, you know, they develop. But there was none of the, you know, do I have to avoid things that may contain processed in a facility? Like, there wasn't even practical food allergy advice. I feel like I started making that up on my own and just figuring it out. And I have seen very few allergy practices that include emotional support in it. I think it is really, really needed. I think it is very much a missing link in allergy management, is the emotional piece of it. But I also think the practical allergy piece, you know, that we all know as food allergy parents, like, we know all the little tips and tricks. And wouldn't it be nice if someone told us some of those things and we didn't have to learn them the hard way?
Is this the reason why you co-authored the book, Treating Food Allergies with Modern Medicine? Because I feel that a lot of your advice is so valuable, but it was part of a joint effort with a dietitian and a pediatric allergist. Was this one of the motivations behind co-authoring this book?
Absolutely. Yeah, it was absolutely wanting to get, again, not, the practical strategies of how we manage so many different allergies. And I think try to give my daughter as much independence and freedom as she could have, but within this very protected, overarching, I don't know, it was like building a sphere around her of safety and then trying to give her all the freedom within that she could have. There's a piece of it that's in that chapter, but then the emotional stuff, which I do touch on, that is really near and dear to my heart. And I think I talk about it with families in my private practice. And there's not great resources out there. I know I was frustrated, and I think it's gone better. The internet has gone better and there's more and more, but there's still a vacuum of information that is evidence-based around how to deal with emotions and mental health issues related to not only food allergy parenting, but the kids themselves and how they're managing it and what they're growing up and dealing with.
And when it comes to specifically OIT journey, if you could think of sort of 3 top tips for families who are currently in that transformation process, for adults and then for children, what would be your 3 top tips, pieces of advice?
Okay, so for families that are already doing OIT and probably have kids that are all different ages, I think probably number one would be for parents to have good support. So I just think, as a parent, we're like the leader of our family. We're the ones who have to figure out what are the decisions that have to be made. What are the boundaries? I might have a child that protests. What do I do if they refuse? Like there's all these unknowns that are probably pretty likely to come up. And I think the more well-grounded a parent can be and the more tools they have in their toolbox to not only manage their own reactivity, but their child's reactivity, the better. So I would start in terms of parenting with parents getting the help and the support that they need. And if that is working with a professional around how to deal with their own anxiety or their own reactivity, maybe to their child refusing to do something, like that's a really common thing for parents is they get very upset that their child refuses to do the thing that is actually in their best interest. And they know that, but the child doesn't see that. So, those are things that you can work with a professional. You can just have good friends who help. You can have a supportive partner, but really getting those in place so that you can try to stay as grounded and mindful and present and intentional with your child as possible. I think number 2 is teaching kids emotional intelligence. And what I mean by that is teaching them about emotions, and that emotions are not good or bad. They're just information, and they tell us something. And sometimes when we have painful emotions or painful thoughts, they're actually telling us something really important. Because if you flip that over, the flip side of the pain is a value. What I mean by that, it's like, if you're afraid of bad thing happening, it's because you actually value either that experience you're going to have, or you just at a more basic level, you value your life, you value your health and safety. So, there's a thing in there to, I think, validate and empathize with. So no matter how the behavior is looking and what's coming out, there's an emotion in there that you can try to understand for a child and help reflect to them. I think a lot of times we're our children's mirrors. So we are showing them, like they're like vomiting out things into the world, and we can selectively mirror things back to them. So, we can mirror back emotional language and emotional allowance, like allowing these things to be there. And it doesn't mean anything. It's there. It is an experience you're having. You're having an emotion. You're having these really hard thoughts. Again, I think as parents, we sometimes are very reactive. Our child says something and our mind goes to fixing it as a problem. And I think the more we can actually not see it as a problem of just, oh, how can I be with my child in this moment? How can I just join them in the experience they're having? Oh, you're feeling really scared. That makes sense to me. Tell me more about that. How can we ask questions? We're not agreeing, we're not enabling it when we do that. We're actually making them feel less alone with the experience they're having, which, going back to our emotional bank account, is going to make them more cooperative. If we actually can say, oh, you really don't want to do your dose today. Like you're really scared. Like this just brings up thoughts like, okay, tell me about that. What kind of thoughts are you having? What are you afraid is going to, you ask them questions and then you reflect back what you hear and you empathize with them. And more often than not, you'll find that they might be more cooperative at the end of that. I'm not saying that we're doing it manipulatively to get them there, but you might find that they're more cooperative in taking their dose or doing something if we've gone through that step of seeing them and seeing their experience and not saying to them, it's not that bad. Why are you being so dramatic about this? Or, we don't have time for this. We're late for school or whatever it is. If we just kind of say, oh man, you're having a really hard time. I get it. Tell me what's going on. So those would be my tips, right? So parents kind of support themselves first, because what I just said is such hard work. I mean, again, it sounds easy for me to say it, but doing that in the moment when we are busy parents and we're juggling all the different demands and we're already at the end of our wits, our wits end with our kids, and then they throw something at us, to not react is kind of like a miracle actually when that happens. But if we can learn how to do that, it will help them.
And tell us about your latest project, Food Allergy Hive. Many of our Australian participants wouldn't really know much about it. So how did that come about? What is Food Allergy Hive and what is the goal of it?
Food Allergy Hive, so it's new. I just launched it in June, at the end of June. It's an online community trying to provide emotional support and connection around food allergies. So it does come out of, you asked me about why I did that book, some of the reasons behind it is trying to get some more of this information out. And this community came about. It's something I've thought about for a long time. I've thought this is what's needed. I wish there was something like this out there. And then I think during the pandemic, for me, things kind of came together where I thought, I had such long wait lists. You read my bio off of that book, which is like 3 or 4 years old. Now I am licensed in the United States. I can practice in more than 40 different states because of different laws. So all of a sudden I'm being flooded from all over the country by people who are food allergy families, individuals who need help. And I was not able to help them. And I was starting to feel more and more overwhelmed by my wait list and this feeling of I can't get to all these people and they need help. And they need support. And the stories I hear from people are so familiar. Maybe they have found another therapist and the therapist doesn't understand it. They don't get food allergies. They're dismissive of the precautions they need to take or the anxiety, and it doesn't work, or they've looked and they just can't find anyone. So all this was happening. I was feeling kind of burned out anyways during the pandemic. I was feeling overwhelmed by the need that was out there. I had this thought that something like this would be really helpful. And I think it came together starting about 6 months ago because my older daughter went to college. So I suddenly had more free time to actually sit down and start doing it. So my hope and my goal for it is to be able to take a lot of what I do in my private practice with people. I do the education, some of the skill development is very similar. It's customized for each person, but really I'm drawing from the same toolbox. And so my hope is to put as much of that online and on demand as possible. So people can access it when they're having issues, when they need support. It's something that they can log on to and go and get the help that they need. And so what's in there right now are some workshops that cover things like how do you manage food allergy anxiety, or how do you coach your child to manage anxiety, or how do you focus on the foundations of emotional health, like diet and exercise and social connections and sleep. How do you kind of take care of yourself so you're better able to tolerate all the hard things that happen? So there's those workshops. Then there's shorter things if you don't have very much time. There's 5-minute or less video clips. There's downloadable tip sheets and scripts that you can use for yourself, or you can give to family members or friends who are looking for ways to help support you. We have drop-in support sessions for members, and then community events. There's a community space that looks a lot like social media that people could communicate and support each other if they wanted to.
Why is there such a lack of food allergy psychological awareness from a practical standpoint? Because a lot of psychologists in Australia and globally would look at food allergies as a generalized anxiety, which of course we know it's not. But why
Right.
do you think there is such a gap in this from a licensed psychologist perspective? Why is this not like at a subspecialty, or what is your take on that?
I guess my take on it is, if we just look at it as a field, it's evolved. I think the people who do it are all food allergy parents, right? So far, there are people like me who already were therapists or psychologists, then had a child, and that became part of the specialization, probably because of personal experiences. So I think as a field, it's kind of evolved very organically from people's personal experiences. And I think we're now maybe shifting, because what I find really exciting is now we have this whole wave of children who were food allergy kids in the 90s and the early 2000s who have grown up. They've gone to college, they are forming their careers. And there's a lot of now new therapists that have food allergies themselves. And I think since they're the ones who are going through school and training right now, they are bringing that information into their training programs a lot more and saying like, no, this is actually something, like this is a real thing. And they're educating the people around them about why it's different and why you can't just treat it the same way you would treat generalized anxiety disorder or a phobia or something like that. So I think they're change makers. I think these food allergy kids who have grown up and now are entering the mental health field are going to, I think, have a really profound impact on maybe it becoming something that people specialize in, even if they don't have food allergies in their life. But as of now, I don't actually know anyone who specializes in this who does not have food allergies in their life.
When it comes to social media and misinformation, there is a lot of misinformation out there, including surrounding food allergies.
Yeah.
I mean, we saw recent ads by big companies almost ridiculing food allergy families, and that having also, a PTSD effect on the other side within the food allergy community, which is becoming more global. When it comes to PTSD specifically, to what extent is PTSD part of your counseling? How much do you see that in your practice? And does that need to be looked at differently from general food allergy counseling, or is that an integral part of it?
I do think it's an important part of it. When it comes to trauma, I think we have to differentiate trauma from PTSD, because people can have traumatic things that happen to them. And I think anyone who has lived through or witnessed an allergic reaction, an anaphylactic episode, that's traumatic. And so something can be traumatic without it developing into PTSD, which is a clinical disorder and has a set of diagnostic criteria and has to have stuck around for at least 4 weeks following whatever the incident is. There's a lot of criteria to that. So there are definitely trauma, and PTSD is more specialized. I think anyone who is working in the food allergy space, if they are treating true PTSD, they should have specialized training in that. I think what happens a lot is that we're dealing with the trauma that maybe hasn't made it to PTSD yet. We're dealing with those days and weeks after a traumatic incident has happened. And you might have a person who is scared to go back to wherever they had the allergic reaction, or they're very scared about whatever they're putting in their mouth. Maybe they stop eating, maybe they're restricting. Like there's all these things that might be happening that would not get labeled PTSD if that's immediately following. And there's a lot of really helpful things that therapists can do to help support individuals and families during that period to make sure that it doesn't evolve into PTSD. And I think one of the most important things, and we know this from the PTSD literature, is when something bad happens, when something traumatic happens, which is trauma is really, something happens that we don't have the skills to navigate and deal with. So there's a gap, there's a gap between whatever the demands of a certain experience are and our ability to handle it. And that gap changes us. It changes our brain. That's kind of some of the definition of trauma. And so allergies count as that. Allergic reactions count as that. Part of what helps people not move on to develop PTSD is not feeling alone with that reaction. So I think for families, being able to figure out, how do I build that connection and that emotional literacy around what happened? How do I talk about it with my child in a way that helps them make sense of what happened and helps them feel more empowered and capable for managing something happening in the future, which I'm very pragmatic just when it comes to food allergies. I think reactions are probably somewhat of a given, like they're going to happen. I can't perfectly control the whole world for my daughter. So as much as I would like to avoid every reaction, like in my head, I'm thinking, okay, I am trying to avoid as many reactions as possible, but I'm also trying to equip her for the skills to manage a reaction and to bounce back, to have the resiliency following a reaction. Like those are also pieces that we need to pay attention to, because if we're only paying attention to preventing reactions, we're missing this whole other piece that happens when a reaction actually happens. And I think it takes a lot of people by surprise. They don't know what to do with their own feelings. Just as parents, I hear this a lot from parents in my practice. They don't know what to do with the fear that they have. And so they can't really be present when their child is anxious or when their child is having emotional reactions. They don't know what to do because they don't know what to do for themselves. And maybe they grew up in a way where they were not held in connection when they were having big, scary emotions, you know? And so I think what we want is we want to be able to give to ourselves connection around emotions. We want to give that to our children. So we want them to not feel lonely in that experience and to focus on the things that are in their control and they can do something about. So if we take our reactions rather than thinking they're doing something wrong, we're thinking, oh, what does this tell me about me? This is telling me something really interesting about me. Like, why am I reacting so strongly to this? Why is this bothering me so much? We can start to learn and grow. And so I think in the context of food allergies, yeah, this is going to provoke emotional reactions. How could it not, right? There's something wrong if you don't care, you know, about your child having allergic reactions. Of course, we're going to be anxious. Of course, we're going to be worried about stuff. And so if we start then getting in touch with ourselves and our own emotions, it's going to help us be better people. It's going to help us show up better for them. It's going to help them be better parents if they're parents one day, partners, friends. I just think, you know, it's changing intergenerational cycles of how we deal with emotions.